So, Mr. John Wasco, thanks for sitting down with us. And yeah, since I came back in 2000, like I was saying earlier, you're always one of the more interesting people I've met on island. You're always generous with your time, and being willing to give a stranger or somebody you just meet the conversation and stuff. And I know you have a lot of things to say. Mm-hmm. So yeah, thanks for coming on. 2003 was the first time I saw you. I don't think I met you. I just saw you at the Turkey Run, Leone High School, and you were just doing a lot better than a lot of other people over there. And I was like, wow, look at this old guy, lapping people, and from then we've met in several places and had different conversations about a lot of different things. So I just want to give you the opportunity, just to come out and speak on something that you feel strongly about, or just share yourself and introduce yourself to people that might not know you but see you around and stuff. So you are still doing the Turkey Run 15, 17 years later? How long have you been doing it? Because I think the Turkey Run's only been around like for 20 years. Have you done all 20 years?
It's more like 30.
30 years? Wow. Mm-hmm. Oh, okay.
But let me share something with you. Back in the late 80s, early 90s, we had the Navy League. And our Navy League program included a swimming program and a program where the kids could use the boats. And it was your family. Your brother was one of our Navy League cadets, because we were mostly oriented from all the kids in Utule. So that's really how I got to know your family and your mom.
Okay.
I don't know if you know that or not.
No, I still think maybe, we'll get to that later.
Uh-huh.
But I remember a few years ago, you were training for some kind of senior Olympics, right?
Yeah.
What year was that? Is there another one that you're going to be answering? I mean, as soon as all this COVID stuff, are you still training?
I am. The way it works is in what they call Masters Age Group Track and Field.
This is nationally or
internationally?
Internationally,
yeah.
All right.
The age groups go by 5-year increments. So you're never really getting older, you're just moving into another age group, you know what I mean? You walk in and you're 75 and you think, I can beat those guys. So my first competition was actually in Apio, and I participated in the Oceania Masters Track and Field. And then I didn't compete again until 2013 at time. But again, going back to my old days in Utule, it was the Samoana track, because remember the stadium wasn't built in those days. Right. So that's where I used to train. I think in some ways being active physically, is kind of an inspiration to a lot of people. And a lot of people see me just like you mentioned here today.
Well, I've seen you at the track, and this is a while ago, but I know if I see you at the track, then I'll probably spend more time than I would have, just because I'll feel like a piece of shit if I just leave early and you're still out there doing your work and you're sprinting down, the track, and I'm like, holy shit.
Right.
I'll spend another 15 minutes just walking and stuff.
Good. I hope everybody has that same feeling. I think it goes to how we make our contributions in our community. Yeah. And I feel pleased, especially for my family. My wife is the supervisor at the intensive care unit. My daughter has a master's degree in sports medicine. My son is up in Davis, California. So we look at each of us and we ask ourselves, what can we do individually that will improve our community or contribute to our community, our church, our village in some ways. So we've kind of kept that as being that's kind of the base of where we want to be. We ask ourselves every day, what are we doing that is going to either improve our community, our village, our church, or whatever. So I'd like to share with you some of the things that I feel that need to be improved, that we're taking some steps right now. Certainly, one of the things that is most disconcerting here in our community is the fact that the general health of American Samoan people is really not very good. And
that's putting it lightly. It's horrible.
I was made aware of it back in 2005 when the WHO, the World Health Organization, published a report on what they call non-communicable diseases.
Yeah, NCDs.
And that is things like diabetes and heart disease and hypertension. And unfortunately, many of these illnesses afflict our community because of several reasons. We're not sure why. Diet may be one of them. There may be some genetic issues there as well. I don't know about lack of physical activity, but it's been difficult for our medical services. Sometimes they're overwhelmed, and sometimes the model that they have has not been really conducive to treating these illnesses.
Yeah, which is one thing that you said you want to talk about is the model that we use now is based on the Navy model, right? And
you're exactly right. And that is that when the Navy came in, it was one medical provider, one hospital, operated by a government agency. In those days, it was the Navy, and then it handed over to the ASG. That's been the model that we have lived with for 120 years. And by and large, I have my compliments to LBJ is that it's certainly one of the more compassionate. That is that no one is turned
right.
away. And people are cared for in a very humane and loving manner in ways that I think are superior probably to the mainland United States. But that doesn't resolve the fact that we still have a medical problem.
Right.
I was involved in the development of the Hope Dialysis Center, which really sort of changed that model. That is that it became a private practice who could bill Medicare independently of LBJ. And that was the first privatized Medicare certified facility. Our next step will be to build a geriatric center.
The link that you sent that I looked over, yeah.
Right, and that is that Medicare only covers persons over 65 and dialysis patients. So unfortunately, we're going to have to look at persons over 65 and their health care. And the changes that we're looking at are twofold. One is how healthcare is delivered. Unfortunately, a lot of people don't either have the ability or the physical ability to come to LBJ to be treated. And as we know, the emergency room and the clinics can be a long waiting time. So if you're disabled in some way or haven't got good physical, you might have to wait 2 or 3 or 4 hours.
Right.
So what we're proposing is a fleet of teams that will actually go out to your home. It's called home health care. It's trending in the United States, and we're going to bring this business model to American Samoa. In other words, people don't have to come to see us, we go to see them. And once we see them, then we can diagnose what their issues are and treat them at home, either through direct intervention by having nurses, physical therapists, wound care specialists come to their home, or by telemedicine, or by actually having them come into a clinic. So there's two things. Going to people's home, treating them physically in their home. But since 2008, American Samoa has invested over $200 million in our broadband capacity through the BLAST program, Blue Sky Intervention, the Hawaii cable, 2 other undersea cables. We're going to have to put that technology to work in order for American Samoa to grow a new economy. So when we look at the healthcare side of that, we see the capacity of geopositioning systems to be able to optimize and maximize how we actually reach our patients. We see the ability of telemedicine. We see our capacity for imaging. And we see our ability to share data through either database systems with other hospitals, whether that be LBJ or Queens or any of the other hospitals in the United States. So we have this technology available. We have the business model available, and we have the medical professionals available. So that's where we want to be as far as healthcare delivery and the way that we're going to be able to treat our people and not only restore their health, but restore the health to improve the health of families. And there's one more thing I'd like to share with you about this, because it's been problematic not just in the medical field, but also in the technology field, and that is that so many of our young people have not returned to American Samoa to share with them the skills and the talents that they have learned in their educational careers. Part of that has become because of the salary differential between the mainland United States and American Samoa. But when we take a look at the economics of operating a private clinic, and that is one that can bill Medicare separately or what are the other insurers, whether that be VA or the TRICARE program, it doesn't matter. We can calculate that young doctors, whether they be in the Oceana University medical system or some other medical system, can return to American Samoa, operate and own a medical clinic, and generate the same amount of income, not just for themselves, but also for the medical staff. So that's a huge...
That's comparable to off-island.
It is, exactly. So that's a huge advantage. And that starts repatriating our best and brightest kids and starts bringing those services back to American Samoa. That's where we want to be. So it's those kind of services and those kind of technology-oriented industries, whether that be in manufacturing or whether that be in finance or whether that be in healthcare or education, that we want to be able to accentuate and grow so that American Samoa becomes not just a home for our community, but a economic center based on the technology that we've invested so heavily in over the past few years.
Right. Okay. So the money that you were talking about that they would be able to make that's comparable to off-island, right? That comes back from where you said Medicare or Medicaid? Right. How they give back 4 times what you put in.
Okay, you're touching on a very good point. Medicare is a federally funded program that is applicable for all persons who are either 65 or older or on dialysis. That's all that Medicare covers. Medicaid is a state-run program that depends on a local match, but that match is 4 to 1. In other words, for every $1 that American Samoa puts in, Medicaid will put in $4. So we don't want to lose that. We want to be able to create a system. I'm suggesting that we take the taxation money generated from our private clinics and put that into a pool that can be matched by times 4. And we start to build up a reservoir of revenue that can be used to handle the health care for people otherwise not covered by Medicare. So, you know, we want to grow both systems, but ultimately the result is that we want to make healthcare a priority in our community because healthy people have a better lifestyle, they're more productive, and, you know, we don't want people, especially people 65 and over, to have a quality of life that isn't the maximum that will really give back to them in their older years.
Well, that's the key right there, right? It's the quality of life. It doesn't matter if you go to 80, but if you're not living the best quality you can, then, you know, I don't want to say it's bad, but you just...
No, you're right. You're exactly right. And I think families will embrace that just like anyone would embrace that and say, yeah, I want my mom and dad to be healthy when they're older. I want to see my grandma and my grandfather
not
healthy.
Just stuck in the house, you know, in front of the TV or just waiting on people to come, you know, help them out, but out there in the yard, you know, pulling weeds and sweeping.
You know, and it goes beyond that. There's an unfortunately statistic that many of the people who have dedicated their lives to the American Samoa government and who are retired and receiving Social Security or through the retirement fund are motivated to leave the island because they know the healthcare system is not as good as it could be. We want those people to come back, and we want to bring back those revenues with them, and we want them to come back so they can live with their families and live out the rest of their lives, in their villages and in their communities. And a lot of that depends on the quality of healthcare that they can expect.
Right. So you brought up the Hope Dialysis, right? So you're involved with that.
I was an original investor, and I'm still on the board of that. We want to expand that right now and extend that to geriatric services and right now wound care, because that's
Yeah, it's on the link, and I'm sure we'll be able to share the link on our page so that if
sure.
people are interested, they can go ahead and. But yeah,
that's a lot of it. So in the future, one of the things that I'd like to see is that the private clinics can handle these issues so that they take a lot of pressure off the LBJ, and the LBJ can concentrate on the things that they do, because they have facilities that no private clinic will ever have. Their surgical theater, their pharmacy, their laboratory, and things like that. So I think the two systems can work together.
How has the relationship been so far between Hope Dialysis and the LBJ?
I think pretty good. I think pretty good. As long as everyone understands that they're working toward the same goal, and that goal is the overall general increase in health of citizens. That's the most important thing. So we want to add to that. So
I don't know the particulars, but how much people do you guys serve at Hope?
I don't know what their census is right now. Their patient census right now is.
Is it like? It's the same as LBJ, or you guys do a little bit less than that?
LBJ has a lot of patients. I think they have about 160 patients right now.
And what do you?
I don't know what the exact number is. I'm not there on a day-to-day basis, so I don't really know. I will tell you this though, that I think we have 5 students right now who are in the Oceana University medical system. One young woman is doing her residency right now. We have another young woman who is in her 3rd year. We have, I think, 3 right now who are in their 1st year of medical studies. And it's funny because that program allows the students to take some of the science courses online. And there is an agreement with the hospital in Motuatua in Apia, where they can do what they call their clinical rotations. So it's a combination of online and clinical rotations in Apia, and all of that has been certified. So when they graduate, they are certified as medical doctors either in the U.S. system or in the British system. They can make a choice. So we're looking forward to see some of our best and brightest kids come back and be able to provide health care for our people. We want to make sure that they have a system set up for us that they can earn, what they would earn in the mainland United States. That's kind of one of our goals.
Right. Okay. How about we switch gears to something, I guess, less heavy, more lighter? So I don't know if you've heard. I just read this last week, where one of our well-respected traditional leaders was doing an interview, and he brought up the fact that there are some people that believe we would be better off with the governor that was appointed from D.C. or somewhere else, basically a Palangi governor. That's basically. I don't know what the context was. I don't know how serious it was, or if it was just something you're just being sarcastic. But I know you've heard it before. I've heard it before, where people are like, things were probably a lot better, or things were better when the Navy was handling the islands and stuff.
Let me share this with you. I came to Samoa in 1981, and I was a Peace Corps volunteer in Apia at the technical school. So I had a little different initiation as to about the Samoan group. So when I came to American Samoa in 1985 with my wife, who is from Whangalii, Upolu, I had a far different view, and I understood, for one, everybody's related. You're going to have family on both islands, 4 islands, whatsoever. And a pretty clear idea of what the cultural customs, especially of religion, of family, of villages were. So when I see other Palangis that come from California, they don't bring with them that same kind of experience. and they always want to make that comparison. This is the way we do it in California.
Or New York.
Or New York, whatever they came from. So on that basis alone, I really don't want to see anybody from mainland coming around here and telling us the way it was supposed to, what is better in California or better.
But it goes back to the kind of complaints where, there's too much nepotism and all that stuff that comes with it. But that's just part of the territory. Another point he made up was maybe we're better off with a woman governor. I don't know your thoughts on that. But
let's go back to that nepotism. We have 55,000 people. Everybody's related to somebody some way. So I don't take that as much of. I don't think that is a criticism as being very legitimate. Nobody would be nobody if we went by the nepotism, because everybody's related to somebody.
Right.
So I don't take that. When you take a look at American Samoa compared to the other territories, whether that's Puerto Rico or British Virgin Islands or Guam, American Samoa I think stands up pretty high in the rankings in that. I would take American Samoa's record for governance over the other territories.
And the other thing, like you said, it's a small population, 55,000 people. Right. So all the flaws of government and stuff, it's going to be right there in front of your face. So it just makes it just that much in your face where people, do have those complaints. But yeah, there's corruption in the United States government. There's corruption everywhere. And, it just... flaws, but I think, like you said, compared to other places, we got it good, and we're doing a good job. I just, like a lot of other people, we just wish we just progressed a lot faster than we are.
When I get comments from people. We've just invested $200 million in our broadband and internet facilities. We have to make that work for us. There's no other territory, very few states, very few cities can make that claim that they have a gigabyte community. We have a broadband system that delivers 1 gigabyte to every home and business right now. Nobody can make that claim. We have to build on that. What we discussed here about the medical facilities and how we're using technology within the medical, we have to expand that to different areas of the economy, whether that's through financial technology, fintech, or banking systems, or manufacturing, or education. But we have to make that technology work for us. So while we're here talking about home care delivery, which is a very, very basic thing, it kind of goes back to the old doctors that actually made house calls. That's a very basic, but to be able to integrate that with the technology of geo-positioning systems and database and imaging, now we're combining very basic values with technology that accentuates the ability to carry that out. American governments, American communities have a lot to learn from American Samoa, especially a way how families care for each other and how extended families can not how they can share, but how they do share, not just the benefits of family, but in some ways the grieving, in some ways the joy, in some ways the happiness as well. So I think we have a lot to teach the mainland the United States. So any Pelangis that come down here, they got a lot to learn before they start telling American Samoans how to live their lives.
All right. So the second part, we ready for a woman governor?
If you take, I just read an interesting statistic the other day about where the COVID-19 has been most contained. And every one of those countries, especially New Zealand, is being run by a woman, a female chief executive, whether that was Merkel in Germany or Jacinta, what's her name, Ardern in New Zealand. Well, there's a lot to be said. I think that's going to. I think they're going to make their point here after the experience with the COVID-19.
So bringing up COVID, how much longer should we be on lockdown as far as closing our borders? What do you think personally?
Well, I think we got lucky. Yeah. Most of the only way that was going to happen here was being transferred from some off-island person that came down here. Thing that didn't happen for us.
How long do you think we can afford to, close the borders?
Well, I have to compliment Governor Molinga because he hasn't allowed the economic downturn to dictate whether or not we should jeopardize our health standards. And it's very tough for the state's governors, because the businesses are going broke,
Right.
and thing. We can see that they have to make that balance between general health and the general economy. Very difficult decision.
Right.
Governor Molinga, Lolo, has not had to make that. People have been very accommodating in the fact that says whatever it takes, that's what we're going to do. And consequently, we have preserved the health of our community here. Because, in a small island, a contagious disease can get around very fast. So not only have we been lucky, but I think the government has taken a very defined stance on deciding that health was at a greater benefit than whatever economic disadvantages we might have to.
Right. Okay. So COVID stopped our basketball season. I know that you love basketball just as much as I do. Yeah.
Well, I think the most important thing is I'm starting to realize I can live without sports.
Right?
Yeah.
A lot of us are realizing what we can and can't live without.
I check the NFL transactions and then that's it.
Yeah. All right. You think there's going to be the regular start to the season for the NFL?
Difficult decision,
Well, if they think they're protesting now, you try to stop football. You know what I mean? I think there's going to be a lot more passionate protesters out there. You take away football from America.
Yeah. So those are the kind of things that we're going to be facing. And I'd have to say is, I think everybody has come to the conclusion that these kind of contagious diseases of which there's no vaccine, there's no cure, they can strike at any moment. And this is the first one we've had to deal with. But everybody in the back of their mind says, this could happen at any time. So we're going to have to get used to realizing that the way we've lived and the way we've enjoyed social contact may be changing substantially for many years to come.
That's unfortunate because if you really look at it, I think it's been going that way, right, for a while now. With social media and stuff, less and less real contact, right, and relationships. And now with the COVID, and like you said, at any time this can happen. This is just gonna, make, I think, probably, pull things more that way faster.
I don't think there's any question about that. You're right about that. I guess we're all going to have to go through some kind of learning process about where we want to be as individuals and where we want to be as far as
our relationships,
the contact between our relationships, not just within our own family, but within our communities and our extended families.
Right, which is probably just as important because you want that relationship with strangers
be
able to,
it is. Yeah. So we'll see. When American Samoa is going to open up again? Well, I think the next flight is coming in May 30th?
I'm not too sure, but I heard soon.
Right. So we'll look forward. One of the things we hope for is that the federal funds that have come through the COVID-19 stimulus are put to use, that in the future we'll be able to identify and be able to contain any kind of and test for any kind of viruses that may come our way. I hope that that money will be well spent and used as preventative measures because it's going to happen again, I think.
Yeah. Well, hopefully we're better prepared, and this has been a learning experience for everybody.
It has, for sure.
This. We'll end it on that, Wasco. Thanks for coming out, and I look forward to doing another longer one because I know there's a lot of things, you have to share and a lot of interesting things I want to listen to and conversate about. But I appreciate your time. And
so I'll leave you with this, we started off talking about my running career, I was running in high school and college, and after college and whatnot. So I've accumulated a lot of knowledge about how this sport. So right now I'm involved in writing actually a book about running that is really focused on people who may have been competitive in their teens and their 20s and kind of laid off, driven a desk and a computer, want to get back into it. So what we want to do is we want to be able to give advice to those people so they can get back into the sport and be competitive and look forward to a healthier lifestyle in their 60s, 70s, 80s, and beyond.
So when are we going to be looking forward to this book?
Yeah, right.
Next few months?
Not too bad. No, it's
When
going.
are you going to be able to bring out your book?
Yeah, I'm actually working on it right now. I have some chapters, but we'll look for a publisher and see how that goes.
Oh, well, good luck with that.
Yeah, thanks. I appreciate it, and thank you very much for having me here today.
Right on, Moscow.
All right. Yeah, take care.